Hi, everyone. My name is Lawrence Daniel, Community Mobilization Officer, Center for Initiative and Development, Taraba State, Nigeria. I'm presenting on the topic, prevalence of hepatitis B virus and implication for vertical transmission among pregnant women in rural communities. I have no conflict interests whatsoever on this research that was conducted. And our organization is all about patient-driven. It's a non-governmental organization and a research-focused organization. And here is our mission and vision statement, which you can read it. And I will go straight to our objective, which states the prevalence of, that is to determine the prevalence of viral hepatitis B among pregnant women attending antenatal across healthcare facilities in rural communities of Taraba State in Nigeria, and also to determine the barriers associated with the elimination of mother-to-child transmission of viral hepatitis among the pregnant women in Taraba State, Nigeria. And the third objective was to determine the HPV vaccination status among children born in those facilities. As you can see on the background, which some of my colleagues might have presented on it, this report is according to the NICE 2018, including the prevalence rate of general population and pregnant women, which ranges from 8% to 5.9%. I am so particular about the pregnant women, which is 5.9% as of 2018, which is very alarming. And an estimated prevalence rate of infection of virus hepatitis B infection among children less than 5 years was 4.1 to 13.1%. That report came from a Federal Ministry of Health in 2018. And CFID conducted its own research previously and found out that in Taraba State, the prevalence rate is 12.5% to 4.7%, that is for hepatitis B and C. This is very alarming, and which necessitated us going into this research. Then we use the following methods. One was awareness and sensitization among stakeholders and gatekeepers. We also selected medical professionals, which cut across medical doctors, nurses, midwives, CHUs, JHUs, World Health Development Committees, who are the retired healthcare professionals who reside in those communities. We also engage our volunteers and traditional birth attendants to carry out the viral hepatitis B testing and counseling during ANC in line with World Health Organization guidelines. And you can see the total number of healthcare professionals that were trained, which are displayed on the graph here. And this is the graphical presentation of the data at the end of the program, which ended in November 2022. We tested 2,344 pregnant women, and out of which 201 were positive to hepatitis B, and they were further subjected to hepatitis B envelope antigen, and 150 were positive, which were subsequently placed on tenofovir prophylaxis at 28 weeks till delivery. And the prevalence rates among pregnant women shows 8.6%. And while childbearing age women, we tested 370, and 30 were positive to hepatitis B. The prevalence, which goes for 8.1%, we also tested male partners who are husbands of the pregnant women and women of childbearing age, we tested about 199 of them, 19 were positive, which shows 9.5%. Children vaccine coverage, birth dose was a challenge in the community and those health facilities before we started this intervention. You can see the total of 732 children were vaccinated. That is children that were born in the hospital as at then. And the second one were those born during weekends, because in the community, they have this challenge of not getting children vaccinated when they are born during weekends. We also have children that were born outside the facility, which total is 118. Out of them, you can see the number of those that were given the monovalent dose and the second dose and the third dose. These are due to some challenges that the parent face. It could be financial and distance. And in conclusion, the findings shows that there is a high prevalence rate of hepatitis B among pregnant women in those communities. And the intervention by CGHE also shows that there is need for integrating the elimination, the EMTC, that is triple elimination, into antenatal care. And the uptake of birth dose vaccine also is very significant, shows a significant role because of the reduce or because of the nature of the infection from mother to child or the transmission from mother to child. We also recommend at this point that more interventions be targeted towards these groups so as to achieve the 2030 World Health target, that is the elimination of hepatitis among the community. So this is what we're able to get, and I believe by this we will have more funding or more people invested into the viral hepatitis in order to save life, to stop transmission at birth. Thank you.